look forward to it being fully implemented, whatever government is in place in the future.
I call Simon O'Connor.
Yeah, indeed, it will be a national government, Minister, and it's been from a national government or member-led inquiry that these results have come about. But I think there has been a great collegial atmosphere in the House today, and it's a pleasure to rise and to speak to this bill. And I think, importantly, actually speaking as a non-member, and I'll come to that, but I do want to acknowledge, as colleagues across the House have done, Dr. Paul Hutchison, with the gravitas, the energy, the passion and the vision to have led this inquiry. And listening to colleagues speaking, the support that he has gained and garnered from members across the House, from Labour, Greens, New Zealand First, to make sure that this report is tabled before Christmas. As everyone has noted, this is something which is time critical, not only in its nature that it's a report and an inquiry about preconception to 3 years of age, but an area that we, as MPs across the House, want to address quickly and thoroughly across a whole wide range of areas. So can I also take an opportunity to thank Dr. Paul for the work that he's put in. We are all conscious here. We are all conscious here that his time by choice is coming to a close next year, but what a legacy to New Zealand and to our children to leave. I mentioned at the start that I speak as a non-member on this committee. I sit instead on Transport and Industrial Relations and Education and Science. But I think it's quite, well, I find it quite appropriate to stand up because as a MP outside of this committee, this report, this inquiry has stood out. From the moment it was tabled to reaching my desk, it was something I was interested to pick up and to read through, not only on the light version to my honourable colleague here from Coromandel, but the full version as well. It is a result of enormous hard work, and it's been a pleasure to sit in the House during this debate to hear all members speak their particular areas of passion. And I think what I've heard underlying it is the absolute importance of human life. The absolute value of human life, from conception to those 3 years of age, that importance or preconception to 3 years of age, and to put in place all that we can to help young men and women and also our children, our tamariki, to live a good and full life, and a life that we respect, a life that we celebrate, and a life that we in a community draw together. I've always been struck in my years studying philosophy that one of the things I was taught and learnt was from the very beginning we are born into community. We are never born alone. Be it a son to a mother, a daughter to a mother and so on, we are born into community. And I think what's really, and some of my colleagues here I think are trying to emphasise the healthy, they want to get our way to lunch. But what I'm trying to emphasise here is that real important place of community, and I think this report, Dr. Paul, and to those on the committee, is emphasising that real importance of community, our young people in it, and all the elements and support which are needed. So again, my colleagues across the House in particular are keen to celebrate health by having lunch. I think they want me to sit down. But I want to end where I began, by acknowledging Dr. Paul Hutchison for his leadership, his chairpersonship, and to all members of the committee, well done, kudos, and we look forward to a Christmas break, but coming back in the new year to put these recommendations into action. Well done.
Call Lewis Wall.
Kia ora, Mr. Speaker.